I guess we should start by, zeroing in on the New York Health Act. This is a bill that's basically been idling in the New York State legislature in some form or another for, I think, the last 20 or maybe even 30 years. It's been around 30 years.
It's older than I am, yeah.
Yeah. So, I guess the opening question for you is, I want to get a sense of why it's gone nowhere for as long as you've been alive, and what the current status of the bill is. And New York is a Democratic state, much like, as Natalie was saying, California is. And we've seen Democratic leaders over and over say that they support single payer. So what's going on here?
Wow, what a thick and smoke-filled room you want me to empty in probably much less time than we have. But I can say in short that, as Natalie was emphasizing, the greatest obstacle to winning single payer, whether it's at the state level or the national level, is class power. And, as single payer healthcare would nationalize, or in the case of the New York State or state bills would make public like a fifth, 20%-ish of the economy, it poses a serious obstacle to all private interest. And there are a lot of those, and they're very powerful, and they have a lot more money and power than the left has or than the working class has. So that's the short answer. The long answer is that, it's been around for 30 years. It's hit some strides at various points. Every time it's come up for a vote in the assembly, it's passed. But the assembly has historically, or at least for the past 10 years or so, been the more left of the two legislative houses in New York State. But there seems to have been something like an agreement between the assembly speaker and the leader of the Senate not to bring this thing to Cuomo's desk, knowing that he would not like to become publicly on record as being against something that's so popular. So there are a number of things that you can do to keep this thing from getting to the executive, the biggest one being holding it up in committee. This past year, however, we've seen over the past year or two that the Senate has become more progressive. And so there was a hope this year that maybe we would see it passed in both the Assembly and the Senate. But there's an incredible amount of politicking that we had a very inside eye into, thanks to the fact that we've elected 6 socialists to the New York State legislature in the past few years. We got to see just on the inside how 2 and 3 times the leader of the Health Committee would put the New York Health Act on the Health Committee's agenda, and then it would be removed by the leader. Which was something that she I think, and the entire New York State legislature has been sort of held captive by fear of Cuomo for a long time. So it'll be interesting to see how that changes. But yeah, I think there's a lot of mechanics that are available to leadership to keep this thing off of the floor for a vote and out of the executive's office. And frankly, the other major reason why we're not seeing it moving forward in New York is the amount of union opposition to the act. So, and that's something we could talk more about.
Yeah, so I do want to get to the union stuff in a little bit, but first, because you had mentioned the kind of slate of socialists who are now thankfully in the New York State legislature, we actually have a clip of Jabari Brisport trying to, I guess, force the issue, bringing up basically the New York Health Act in conjunction with other things that actually did make it to the legislature floor. So let's watch that clip.
It should be the right of all workers to retire with dignity. It should be the right of workers to have health care. Retirement and pension programs provide a necessary safety net for workers and their families. We should continue to expand these programs. However, we must go beyond just expanding these programs in this instance. Healthcare is a human right. That is why our public sector safety net should be expanded to all New Yorkers. I'm voting aye and urge my colleagues to join me in demanding the New York Health Act. As the bill's authors point out, kelp has significant health benefits and is a nutritious food with a growing market. The lack of affordable, nutritious food is a problem for so many communities in New York, and this bill would help us change that. Because kelp contains large amounts of iodine, it is also used to produce supplements for treating hypothyroidism, a condition affecting approximately 1 in every 300 people in the state of New York. Hypothyroidism is a very serious and potentially life-threatening condition, since the thyroid glands produce the hormones regulating metabolism, mental functions, and energy level. Yet, kelp-based iodine supplements are rarely an adequate or even appropriate solution to this condition. While a healthy diet is important, New Yorkers need preventative health care, affordable prescription drugs, and routine, stable access to medical services, all things that they are often denied under the current system. Kelp can help if it's paired with a single-payer healthcare system. I'm voting aye, and I urge my colleagues to demand the New York Health Act.
So a classic pivot from kelp to healthcare. Christie, talk to us about what's going on here, and following from that, how are groups like DSA and other organizers and advocates working with some of these more sympathetic legislators to get the New York Health Act out there on the floor?
Yeah, happy to. I'm so proud of that clip, and so proud of a lot of the work that went into it. We were talking earlier, or Natalie was, about how we can use electoral politics to win Medicare for all. I think, obviously we can, use the campaigns to shift the discourse. We can use it to push kind of weaker center Dems to the left. We can primary out the worst of our obstacles. But really in New York State, we've had an awesome kind of opportunity to build what looks like a much more, something like a proto party or an early party formation where our electeds are in constant contact with our grassroots organizations, and DSA has been able to provide sort of a connective tissue between unions and community groups and our electeds. So this kind of came out of the day before Jabari did this. We had a massive, public rally and speak out at the Capitol because we were 4 days away from the close of session and nothing had happened. And it was out of genuine frustration that we have all of these legislators who've been elected to on the New York Health Act and have not been able to see it move forward. So their office, who we're in constant contact with, called us and said, we want to do this, but there are 150 bills being introduced tomorrow, and we're going to need to connect every single one to the New York Health Act. And so, it was a team of us who got together and really helped that come to fruition as it should be. I think this ought to be something that is a product of the masses that the legislation itself is for. I wanted to say, can you repeat again what the second half of your question was? I wanted to say a bit more, Jen, but I forget what you asked.
You had touched on it a little, but I was just wondering how groups like DSA or other advocates and organizers have been working with these legislators.
Mm-hmm. Sure. I mean, literally in New York State. Oh, I remember what I wanted to connect this to, which is just to make the case for these state-based legislation, whether it's single payer, whether it's Medicaid or Medicare expansion, or whether it's controlling pharmaceutical prices and marketing and advertising, or whether it's, long-term care initiatives. I think DSA is strongest in DSA, and other membership-based organizations are currently strongest in their state-based formations. We don't have a lot of power at the federal level, so I think it's really important to try to find, as Natalie was saying, legislation that can build constituencies and can also build this connective tissue between organizations and unions and electeds. But yeah, that's really what we've been how we've been thinking about this in New York State, both in the city and across the state, is that our electeds are literally in constant contact with the organization on a weekly basis. We're meeting, we're discussing what they're seeing, and helping them to navigate a very, very lethargic and a very, very smoke-filled room of Albany state politics. I'm not sure. One more to add, but.
And turning to the question of labor, we all know that Medicare for All would actually be really great for unions from taking healthcare off the bargaining table. And for listeners that don't know, I mean, often contracts now, healthcare is the dominating topic. Unions give up raise increases in exchange for keeping their healthcare. It really is dominating every contract negotiation. But as you pointed out, Christie, a lot of unions in New York campaign against this bill. So, first question is what kind of explains that opposition? And then the second question, how do we kind of overcome that and bring labor on board to support Medicare for All when it's very clearly in their interest to do so?
Yeah, and Natalie, feel free to jump in on this too, because it's sort of similar on the national level, I think, as it is in New York State. But in New York State, I think we have some of the greatest union density in the country, but some of the most conservative union leadership. We've heard it said that some unions we can imagine endorsing nationally, but the union locals and their kind of the local groups of those unions in New York State would sort of never endorse. I mean, part of it is because a lot of unions operate their own health funds, which are essentially like private insurance companies for the union. They house their insurance in shop, and they employ a lot of workers and spend a lot of money and make a lot of money by doing that. So that's a big thing that you're not going to hear unions say publicly. Another thing is, as you said, Paul, I think the fact is that there's a lot of union leadership who are not radical or do not want to change the status quo of what organized labor has looked like and don't want to do much more to attract new members to their unions. And unfortunately, that means that they're holding up healthcare as the one or the major benefit that unions can offer, and kind of narrowing the window of what could be possible, what unions could do for their members.
Yeah, I mean, I think that everything that Christie said makes sense, and obviously, unions as they're currently constituted haven't always been super supportive of Medicare for All. Other unions have been some of its most strident supporters. Obviously, NNU, National Nurses United, at the top of the list. Several others have endorsed at the national and or local level, depending on specifics. I also think that, in general, when I said I think the PRO Act is one of the most important things currently on the table that could really shift the dynamics for single payer. As you all know, the labor movement in the United States is not at its strongest point right now. It's in very much a defensive crouch. I think that there is more conservative leadership who are really focused on holding on to what they have won already, and not taking steps backwards in that regard, and that they are, opposing something that really would help them move ahead. But I think that in a context wherein unions can be more militant and, can be, moving forward, they're in less of a defensive crouch. They are able to, demand more for their class writ large. I think that they could start to behave differently. And I think that, over the past couple of years with, what we would consider, a resurgent labor movement in some ways, or some hints of it, I think that there have been unions that have, elected more radical slates, or where, through internal procedures, members have been able to push Medicare for All. One example is CIR, an SEIU union of interns and residents in healthcare, has recently elected a pretty left-leaning slate, and they've really become strident supporters of Medicare for All. I see no reason why that can't happen more. I think that we're not there at the moment, but that's definitely where we want to get.
I should say, I want to jump in and say, I took sort of the most aggro approach that I had to describing the union opposition, but I think I 100% am behind what Natalie is sharing here, that I see no reason to believe that we can't build, not even just kind of neutralize union opposition, but build militant, energetic labor support for single payer. And I think I also could share instances in New York where I see that already happening, both amongst labor leadership and amongst sort of caucuses of members who are not vying for leadership at all, but are just educating other union members about their stake in the passage of single payer.
And I mean, just on that point, as I think you know, Christie, we've been doing work with the labor movement in Philadelphia, getting support around Medicare for all. And interestingly, you know, there's a Teamsters local and a municipal worker union local that have been more engaged lately, and they happen to have new leadership. Not necessarily people that self-identify as far leftist, but I think just because, you know, they haven't been part of the game that has been played for so long, and, you know, certain things that they don't take it as an article of faith that you can't consider Medicare for all, and that's been refreshing, and they've been willing to engage on it. And kind of related to all this, you know, often historically, and when you look around the world, you know, countries have gotten universal healthcare through either a mass militant labor movement or a labor party or a social democratic party. Do you think in this country, like, that has to be the ingredient that gets us there? Is it possible to get it maybe without one of those things?
And certainly countries that have one, not just universal healthcare, but various labor or various welfare programs, you know, union density is a common ingredient. And, you know, it is hard to see what path forward we have in terms of robust universal leftward programs if it's not for organizing workers, increasing union density, changing the way that existing unions operate. So, knock on wood, any day now.
Yeah, I mean, it's an interesting question. I think a couple of years ago, I wrote a piece for Jacobin that was precisely making sort of it's like the chicken and egg thing has been reversed here. Thanks.
Right.
I mean, here we were arguing that we need to win Medicare for all in order to build a mass working class party. But now we're sort of making the opposite argument that we maybe need to build a bit more of a party apparatus. Party apparatus means, a working class, an organized mass working class that is you know, stridently tied to a progressive labor movement in order to win single payer. It's an interesting question. You know, I think the path to single payer is like sort of multi-pronged and multi-year, as we've been talking about here. It's not just, we don't have Bernie Sanders anymore to, you know, show the way to this being passed in the next couple of cycles. But I think, you know, through mass political education that we're doing piecemeal through all of these different electoral campaigns, through, you know, fighting alongside local healthcare fights, and building up like a network of connected community groups, to membership organizations that are tied hopefully to their electeds as well, and then like writing and introducing more like intermediate legislation that builds constituencies. I can see us having like a patchwork way there, absent a party formation, but I think it's multi-year and multi-pronged in my mind.
Mm-hmm. So I think this will be our last question for the two of you, but I want to go back to something that you had mentioned earlier, Natalie, about kind of how I think you and a lot of people, myself included, thought that the pandemic might be an opportunity to kind of move the ball forward when it comes to Medicare for all. In many ways, of course, it seemed like a perfect segue, right? You have this unprecedented, you know, public health crisis, and it just showed how broken our current healthcare system is. Now, like you said, you know, that didn't turn out the way that I think some of us had been hoping it would turn out. You know, even the Emergency Healthcare Act during the height of the pandemic didn't really move very far. So I guess the question for both of you is, both at the state and the national level, do you see a way we can still leverage what happened over the last year and a half to our advantage when it comes to fighting for Medicare for all?
Yeah, I mean, I think that, you know, in terms of when I said that I was surprised by the degree to which it didn't advance Medicare for all, frankly speaking, I said that that's because I think, the federal government did step in effectively to, very surgically address pandemic-related issues, right? For the most part, people's care was covered. For the most part, they weren't charged deductibles or copays for COVID-19 related care. The vaccine is free. Some people have still been billed, and certainly there's a large number of people who seem concerned about whether or not they'll be charged, that seems to have contributed toward some vaccine hesitancy in certain pockets. So I think, there are definitely ways that we can see it made a difference, but not the classic way. Before any of these provisions were set, I thought, the first day of the pandemic, okay, there are going to be people who are, avoiding treatment. There's going to be such a higher death toll than there might have been otherwise. And I think that those things didn't bear out quite to the extent that I thought that they might. That said, I think that there are a lot of ways that are maybe less visible than, I was so scared, like care is so expensive that I didn't seek out care and then had, a massively consequential health problem as a result. The very classic paradigmatic stories that we might associate with, showing why we need Medicare for all. I think that maybe one of the biggest ways that our healthcare system has failed us. I do think, the vaccine rollout, I think the fact that we don't have a coherent national health system means that people don't necessarily have a relationship with a primary care doctor, that they don't have an institutional relationship, and that it's not as easy to, not only contact people and get them in for their vaccine shots, but, to have a trusted person to talk to someone about their concerns about the vaccine, et cetera. So, I don't know exactly how many people that's affected, but I think that certainly that is a number of them. And I also think that, the way that we reimburse for healthcare and the revenues that hospitals take in are based on reimbursement. And so Medicaid patients pay out to hospitals less than privately insured patients. And so the hospitals that treated the people who were most at risk for COVID-19 were doing so with the most constrained resources. And, people are still going to be studying a lot of this for a long time. People will be poring over data and looking at different data sets, et cetera, for a number of years, arguing about what exactly we can say about the pandemic and how it turned out. Preliminarily, though, it absolutely appears as if hospitals that treat poor patients had worse outcomes because they have fewer resources because of how our reimbursements are structured. In practice, in terms of how we can leverage that, I think that, rallying around safety net hospitals or hospitals that are slated for closure would be in the same group. So we've seen a little bit of that. One prominent one was Hahnemann Hospital in Philadelphia that closed, I want to say in 2018, 2019. That was, a big deal that Philly DSA was out there protesting with single payer coalitions, that kind of thing. So I think that there's probably some room for that. There's also going to be actions related to, vaccine access in other countries. I don't know. Making the case for Medicare for all is a little far afield from that, but certainly there is a case to be made for decommodified healthcare, for access, for equity, and Medicare for all people should absolutely be part of that fight as well.
Mm-hmm.
Yeah, I agree with everything that Natalie said. I would. Especially, I think that's something that we need in order to show people that a different formation of the healthcare system is possible, which I think that lack of an ability to imagine that does pose a serious obstacle to our ability to mobilize popular support and active popular support for it. Is we need parts of the healthcare system to really, really work for people. And obviously the vaccine free vaccines and free testing has showed people throughout this that public solutions work a lot better than private ones and feel really good and improve your everyday life. But like the basic situation now is that there's been like a massive atrophying of even the most basic public health and public safety functions of the state. And I think a lot of people just don't believe in those things. So I think, like Natalie was saying, like we really need to protect our public safety net hospitals. And also, like at the end of this year, at least in New York State, the extension of Medicaid for kind of an emergency period through the pandemic, which applied to everyone who had previously been on Medicaid or was applying for it. You got put on it. Everyone's going to be dumped off of that at the end of December. And I think we have a lot of work to do to make a lot of noise about this and do public education about the fact that, how you enroll for Medicaid and making sure that people are protected by it. But in general, I absolutely agree that, the pandemic showed that an uncoordinated, private, profit-driven, patchwork healthcare system just can't solve the collective healthcare problems of society. We're always going to have collective problems. They're only going to get worse. I think even more than when Bernie Sanders was in the race, most Americans can see now that you can't have private solutions to these very public problems. I think, it has been disappointing so far to see how that hasn't kind of mobilized and more people to get active. But I think during the pandemic, it was very hard because when people are fighting for survival, either because of healthcare concerns or employment concerns, they're less likely to be politically active and politically moving. But I do think it's time to sort of make this a matter of national security. To make the messaging sort of around, you can't have a private healthcare system that exists to deny care to millions of people, because that's really the only way to make profit in healthcare. And we have to be laser focused and centering our message around eliminating the profit motive in healthcare.
If you like this video from The Jacobin Show, please hit like and subscribe. You can also watch the full episode and catch our future live streams by clicking the join button below and becoming a Jacobin YouTube member. Thanks.